this, but I'm going to ask it anyways. Like, how did we even get to this point? Like, everyone, I guess perspective is when while I was growing up, born and raised in Vancouver, I always thought very, very like, oh, we had the greatest health care system. I just assumed so, right? So how did we get from like that point to this point? Was I just completely naive growing up, and then we got to this point? We're like, oh, actually, this is how it really is.
Yeah. I think I have a couple thoughts on that. One is I still think we do have a very good health system. There's a lot of challenges. It is in crisis right now, but the system is a good system, and all countries have different challenges with their health systems. Many countries are facing crises right now, but there's a couple specific things that I think have really led us to the crisis point we're in right now. The first is just simple demographics. We have an aging population in Canada, and so there's people with more complex health needs who need more complex care. And that just is a reality. And it's a reality that applies to physicians as well. We also are aging. We have a big group of baby boomer physicians who are looking to decrease their hours, looking to go into retirement, and they had big panels of patients. And so we're seeing them dropping out of the workforce and then becoming complex patients themselves. So big problem just in the demographics of how many people are available to provide care, how many people need care, and how complex that care is becoming. The other issue, though, is that in the 1990s, there was a belief in Canada that we had too many doctors. And so we actually decreased our class sizes across the country and cut funding for training of physicians. And so I think we're seeing now that that was quite a short-sighted approach when we knew this demographic change. We already knew the demographic change was happening then, but it was so far into the future, it was easy for politicians to push to the future. We think in 4-year cycles in politics. And so that decrease means that people who would be sort of mid career right now, taking on probably the most amount of work, the people who have, their kids are grown, but they're not ready for retirement yet. They're really, that's where we have a smaller cohort is in that age group. And so that's also really challenging the system. And then COVID came and so we had all of this underlying stuff happening. And then suddenly we had a global pandemic. We burnt out a bunch of our healthcare providers. People have long COVID now. There's more complex health needs because of that. COVID's still here and still adding to the burden. So all of these things have compiled in this sort of perfect storm to put us in the crisis point that's now going to take another hit because of the economic situation that we're in. And costs are going to go up within the health system. And that's going to create additional barriers for everyone. So, it's, even though we're working on solutions and I feel very optimistic about some of them, with this economic situation, that's going to add another challenge for the healthcare system.
I remember the 90s when everyone was so worried about the costs, and the easy way was, hey, if there are fewer physicians, they can't charge in the fee-for-service model, so it's just going to make it cheaper. Yeah, unfortunately, very short-sighted.